They were very much flow-oriented. They were very much about coordinating the entire hospital system to bear on the best patient outcome. The people thought processes were very similar to the thought processes that we had with respect to the transformation process. And not only were they looking for a technology platform that would enable us to show what's happening to the patients at any given time, but really build a system where you can actually do the work in the system and be able to impact at the level of a single patient or at the level of 300 patients simultaneously. So the robustness of the system as it was there, the people and the thought process, and sort of the matching of the minds, if you may, in terms of producing something that was really, in our opinion, unparalleled in the healthcare arena at the time. Another example would be when we started our process and we started mapping out where we were, it would take us, on a good day, an average of about 7 to 10 phone calls to admit a patient to the hospital. Today, we don't make any phone calls. It's all done electronically. Phone calls are an exception, only when you have to do something above and beyond what the system can do. I mean, making phone calls, for me, for example, is at least 2 people, if not 3 or 4, because sometimes you're looking for the person who needs to be on that call. And if you have, like we did, about 75 to 80 patients admitted to the hospital every day, times 10 phone calls, times at least 2 people, that's a lot of work that was being done that really did not add any value to the system. It has the ability to be able to tell us very quickly in terms of which patients are in what status, which patients are on the floor, are not on the floor, which patients are, for example, in isolation, so that you know that if they have a pneumonia and you need to be protected from a droplet infection perspective, or somebody has a skin condition and you need to make sure that you're not touching them without having the proper barriers in place. So all that is done by visual cueing, so it enables the people, without having to find out after the fact, but actually prepare before the fact to be able to take care of the patient in the best possible way.